So when I begin taking a blood glucose, I'm first going to start off with standard precautions: is my scene safe? Next, I'm going to state some indications for taking a blood glucose, which would be if my patient is experiencing an altered level of consciousness or altered mental status. There are no contraindications to taking your patient's blood glucose. So moving on through the skill, we're first going to begin by stating the normal blood glucose range, which would be 80 to 120 milligrams per deciliter. Next, I'm going to ask my patient if I can obtain a blood glucose reading and what finger they would like me to use. I'm going to use the index finger here. So next, I'm going to check all of my equipment, making sure I have all the correct equipment. I have a Band-Aid, my glucometer, my test strips, my lancet, some 4x4s, an alcohol prep pad, my trash can, and then a sharps container. Then I'm going to turn on the glucometer. So to do that, I'm going to grab my glucometer, and I'm going to pop open my test strips here, pull one out. I'm going to take my test strip, and I'm going to insert it into the device with this side, just like that, and it's going to turn on. When it turns on, it's going to give you a code. In this case, it's reading 69. I'm going to make sure that code matches the code right here on the bottle, which is also 69. Next, I'm going to prep my patient's finger by taking an alcohol prep pad and wiping it. I'm going to dispose of that in the trash. I'm going to let that dry, and then I'm going to grab my lancet, take the cap off, and I'm going to let my patient know that I'm going to prick their finger, counting down, 1, 2, 3, prick. And I'm going to take that lancet and immediately dispose of it in the sharps container. Now that my patient has been pricked, they're going to have a little bit of blood. The TAs will put this on your patient's finger. Now that I have my first drop of blood, I'm going to wipe away my first drop using my 4x4s and put that in the trash. And then I'm going to get my second drop by expressing the finger here. And then this is the drop I want to take my reading from. So then I'm going to come in just like that. And sometimes it takes a second. And now your device will count down from 10. While it's counting down, I'm going to wipe away the remaining blood with another 4x4, apply a Band-Aid, and now I'm going to read it. It says 38 milligrams per deciliter. So per County of San Diego Protocol S123, if my patient's blood glucose level is below 60 milligrams per deciliter, which it is, it's reading 38, I am allowed to administer oral glucose, 15 milligrams, so that would be 1 full tube. If my patient is awake, is able to follow my commands, and has a gag reflex.